This is a very special interview here on Frontier Africa Reports. I am Bosin Omofaye, and my guest is one of those young innovators on the African continent who are bringing innovation into entrepreneurship that help young girls and women leverage innovation and better health services, including investment across the African continent. Please welcome my special guest today, Angella Kyomugisha from Uganda. She is the co-founder, co-CEO, and chief financial officer of Kaaro Health based in Kampala. It's good to see you, Angella.
Oh, thank you so much. So happy to be here.
Thank you very much. Let's hit the ground running this conversation. Tell me a little bit about those challenges that you think healthcare innovators and entrepreneurs face on the African continent, briefly.
Yes, thank you. So entrepreneurs face a lot of challenges when it comes to Africa. And to be specific, the women entrepreneurs that are trying so hard to get into this space. First of all, there is challenge when it comes to opportunities for business, struggling as a female leader. Most of them are co-founders, most of them are founders of organizations. And you see, when they get into compete for example, funds to start off their innovations, they usually fall off along the way, and you find that a number of women do not get to access the funding that they would otherwise need to expand their innovations. And that is one of the challenges that I personally have also experienced when it comes to the entrepreneurship space, because it is important to note that the entrepreneurship space has got a lot of competition. And so you find that some of the women do not have that persistence once they are hit over and over by challenges. And what we are lacking basically is mentorship for these young girls, for these young women that have that zeal, but after facing some challenges, they fall off. And so I see that as one of the biggest challenges in Africa.
So Angella, when you look across the continent, are you seeing some of these challenges changing for the better? Are you seeing signs that things are beginning to change a little bit on the continent?
Yes. Over time, I have seen so many organizations, governments in Africa, for example, in Uganda, trying to bring forward these entrepreneurs, including males and females at this point, because they are also engaging the men to support the women so that together they can push Africa to the next level through innovation and entrepreneurship. And so I'm seeing a lot of opportunities for young people, for example, for women. Okay, so there is a very huge change, and we should look forward to a change across the globe when it comes to healthcare systems, when it comes to transport. Yes, with increased support, we should look forward to a great change.
Okay, so let's begin to drill down into your operations in Uganda. What innovations and changes are you bringing to the space in Uganda, in terms of young women, in terms of empowering them? What are you doing on the ground? What changes are you bringing to that space? Talk to me.
Yes, thank you. So my innovation basically says the message. You see, every time I mention our innovation or my innovation, I become happy, because it helps other women leaders, to move next, to support their businesses. So basically, briefly, what we do is that we install and deploy container modular clinics in very remote areas, or areas that do not have any facility within over 20 kilometers. So for us, what we do, we deploy these container clinics, and then we empower the container clinics with a nurse entrepreneur. This way, she operates it and is able to serve the community in the end. However, we have over 99% of the nurse entrepreneurs being women or female. So you see what my organization does by holding another woman's hand, empowering her. We start with bookkeeping, because some nurses are young. You see, she's out of school and she has not been able to be absorbed in the public sector. nor the private sector, and yet she has completed. So most of the nurses, for example, in Uganda, sometimes are unemployed and they do not have capital. Like I said, some capital opportunities are very competitive, and this is a fresh graduate. So for us, what we do, we look for such women that have an entrepreneurial mind. We help her acquire this clinic, and then she is able to eventually, through our trainings, through our engagements, she is able to now support and own her own clinic. Because after between 3 to 5 years, we encourage them to pay up their lease so that they can own these clinics. You see, so I feel like my organization, once we now get the opportunity to scale out to other regions of Uganda, to our neighboring countries like Democratic Republic of Congo and the rest of the countries, I feel like we shall be able to train women on how to, start and own their own businesses. And for me, that is everything.
That's a whole lot you're doing on the ground. The kind of innovation you're talking about here in terms of mobile clinics for women in Uganda that you're working on, quite a similar story in terms of education being brought to the nomadic people, folks, millions of them in Mexico. Many years ago, I learned about this on trailer parks. This is quite innovative, and I love that. But what you just talked about requires funding. So talk to me, Angela, how are you finding the necessary funding and investments to start this particular entrepreneurial exercise and continue to get this funding support that helps you to begin to scale up? As you said, you're looking beyond Uganda into DRC, Tanzania, and other countries as well.
Right. So I want to just share, especially even before I begin, that again, in entrepreneurship, you must know and you must be prepared to be persistent, to be consistent, and to have a good team. Okay. So starting out way back in 2016, we had not really validated our model. Okay, we started out just leasing out solar equipment to existing clinics. And so we had not really nailed our model to the point where it is now, where we now help the nurse with the fully equipped clinic, and then she pays it off and owns it after 3 years. We hadn't started that. And so even just with the medical equipment without the clinic, finding the funds was very hard. And I must say we had to use as a team. We had to use our savings. We had to bootstrap and, speak to family members who some bought it, wanting to support you through this. Then others did not, because it's just a startup. So I must say starting out was really hard. And we said, look, we want to give this to the community. We want to do this, and we just persisted with doing that. But yes, we had a lot of challenges. So how we've been able to go through this is by talking about our business to our family members, to our, people that we've come across, then to companies. And through this, people eventually have been, reaching out to us and supporting us and partnering with us. That is how we have made it up to here.
Interesting journey you've had. And in such a very short time, you've been able to secure an award. Talk to me about it.
Oh, I was very honored to receive the award to join the Women Innovators Incubator. I must say I'm humbled on behalf of Kaaro Health, and it's a great privilege because I must say we have so many other young ladies, young people doing great things, but to see that our rural model, our health rural model was appreciated and, given an award, honors us. We feel so honored, humbled, and it has just been about, consistency, having the right team, and then partnering with the right organizations. So that is how we were able to get through the journey of achieving the award. Yes.
Your recognition of getting an award also got you to be one of the speakers at this year's Ghanaian Forum Africa, which started on Tuesday. That will be ending on Saturday, the 11th. Tell me, are there new things you're learning about these issues, the challenges and opportunities, and what more can be done on the African continent when you listen to other speakers at this forum. Tell me about that briefly.
Yes. So this forum has really opened my eyes. It has really showed me a lot of, opportunities that you could actually seize into. It has opened my eyes towards certain problems. We had a number of participants that were doing a lot of great work, that have been resilient, that have been innovating, that have not given up, that are encouraging other women. It is something that I've seen and I want to call a community of change makers. So being part of it has opened my eyes, has changed my perception about what Africa is going to look 25 years from now, as long as we have many women get involved, as long as we have youths involved, as long as we have our leaders supporting this ecosystem. So I must say, change of perception.
It's interesting, Angela, speaking with you towards the end of the year 2021. I'm sure somewhere in your head, you're already thinking, what are you doing moving forward? What new horizons are you looking to conquer? You talk about DRC and East Africa. I'm sure you have something new under your belt that you want to bring forward in the near to medium term. Share that with me as we wrap this up.
All right. So we have a specific program at Kaaro Health that we want to, or are already doing. We want to develop and design a new clinic that is, number one, environmentally sustainable. Number two, efficient to work and easy to use for the nurse. So this is a new version of the clinic that we are looking forward to, roll out in the next new locations, because the model has already been validated. Now we want to perfect the environment under which our beneficiaries or patients are able to receive this service that we offer through our nurse entrepreneurs. Some of the goals that we have set include we are holding the huge fundraising for the rollout of these clinics come February 2022 up to February 2010. And we have a plan written out. And so we are having one of the huge fundraising for this rollout of the clinic. We have already piloted the clinic and we are just looking forward to scaling out to these new regions. However, some of the regions that we plan to scale into are islands and they do not have they have a problem of access. We are also planning around to make sure that we have both ambulances, that we are able to provide a village or a rural place with something affordable, but yet of very good quality. So that is the plan to roll out clinics starting 2022 up to 2010. And we have other plans to, we are hoping that COVID era will change, or we are hoping that there's going to be a shift because people are getting vaccinated. And so we hope to again resume the trainings, to help some young people, some young women. So yeah, we have plans going ahead.
You have great plans ahead. I will agree with you. Angella Kyomugisha, thank you so much for speaking with us on Frontier Africa Report. We appreciate what you're doing on the ground. In fact, this type of innovation you bring in, and entrepreneurship is what brings healthcare to the last mile, to the last man on the African continent, as you take it all the way down to the bottom of the pyramid. Thank you so much. We congratulate you what you're doing over there in Uganda at Kaaro Health. Thank you so much, the co-CEO and Chief Financial Officer of Kaaro Health. Thank you so much, Angela. Enjoy the rest of your weekend. I will talk to you again very soon in 2022. Bye for now.